Hi, I'm Mark Nordenberg. It is my pleasure to welcome you on behalf of the University of Pittsburgh's Institute of Politics and its Dick Thornburg Forum for Law and Public Policy to the 7th program in our Governing in Crisis series. Today we will consider the challenges that have been presented to educators as they develop plans for the safe return of students on a new school year. And it is back to school time in America. More than 56 million students are getting ready for school, 90% of them returning to public school education. Normally, this is a time when schools and homes and individual hearts are pulsing with positive energy. But of course, we know that this school year will be unlike any that we ever have seen. Here in southwestern Pennsylvania, some students are already back in school. Others will be starting over the course of the next few weeks. Some are back in regular classrooms, others are learning remotely, and still others are enjoying a mix of the two. We're very fortunate to have the opportunity to host Dr. Robert Shearer, the Executive Director of the Allegheny Intermediate Unit, who is going to discuss with us some of the challenges that both families and school districts will be facing in the weeks and months ahead. Dr. Scherrer is a native of this region. He graduated from Baldwin High School and then earned both a bachelor's degree and a master's degree from Indiana University of Pennsylvania and a doctorate from the University of Pittsburgh. He went back home to Baldwin High School to launch his teaching career. While there, he was honored as Pennsylvania's Business Educator of the Year and developed an award-winning entrepreneurship program. Then our good doctor became something of a man on the move. He held administrative positions in the Peters Township and Woodland Hills district and was both the principal of Pittsburgh's venerable Taylor Alderdice High School and the founding principal of the Pittsburgh Science and Technology Academy. Next, he moved to North Allegheny, which he says in his biography is consistently recognized as one of the top school districts in the United States, language that I happily repeat as a proud NA graduate. He was the superintendent at North Allegheny when he was recruited to lead the Allegheny Intermediate Unit. The AIU, as it is called, is a regional public education agency that exists to provide specialized services, including early childhood education, special education, and remote education programs to Allegheny County's 42 suburban school districts, as well as to non-public charter and vocational technical schools. Expressing this somewhat differently, the intermediate unit pretty much includes everything except the Pittsburgh Public Schools, which, like the Philadelphia Public Schools, serves as its own intermediate unit. To add a bit of perspective, there are just over 23,000 students enrolled in the Pittsburgh Public Schools and close to 114,000 students enrolled in the district served by the Allegheny Intermediate Unit, which is almost 5 times as many. In addition to the responsibilities that I have mentioned, the AIU serves as a liaison between its member districts and the Pennsylvania Department of Education. It also serves as a convener for the districts and their superintendents. Those roles have been particularly important in recent months as districts have worked together to try to meet the challenges of the pandemic. Dr. Shearer, if I asked you, what have you been doing with yourself the last few months? There is no simple answer, I know, because you were leading a large school district and then you moved over to lead the Allegheny Intermediate Unit. Can you just talk a little bit about that shift and how it coincided with the onset of the pandemic?
Sure. So first of all, thank you very much for giving me the opportunity to be here with you today. So you're correct. I was still the superintendent at North Allegheny when COVID-19 concerns really started to surface in February. We all really started to think collectively more about cleaning protocols and how we might respond if all of a sudden COVID-19 started to spread into our region. We started to look at trips that were outside the region. What were those things that we were going to continue to do, and which trips might we postpone? And really started to think through the longer term impacts if we had something that was going to be a situation where we needed to be out of school for a time. So we were constantly just digesting new information and trying to determine where we needed to go next. A lot of responsive actions versus being proactive in some cases, which we try to do all the time in education. And then of course March 13th hit, and that's a really important time here, at least in Western Pennsylvania, because that's when collectively in the region we determined that we were going to go to a remote learning environment for a period of time. And then shortly thereafter, the state came out and did the same thing across the Commonwealth. And so that ended up lasting for the rest of the school year. And so, when we did that shift, so much of our concerns were on, how are we going to meet all of our students' needs that were going to look very different in a remote environment versus the brick and mortar environments that so many of us were in at the time. How are we going to meet the unique learning needs of students, those with an IEP, special education students, those students that might have English as a second language. And these were very challenging things to consider. But also, in addition to the educational needs of the students, we had to consider things like those that were food insecure and those who we were supporting from a mental health standpoint. And so when they weren't physically going to be with us, what were those other types of supports that we could provide for those students? And so, for me personally, I was living this reality as a superintendent and trying to make all the decisions that affected the communities that I was serving. But knowing that I was shifting into this role in the summer, kind of putting on my executive director hat as well and thinking through what are the best ways that we as a region can support these efforts. And so, it's just been a tremendous lift for folks in the area. I tell people all the time, the complexities of education are challenging to begin with. And then you add something like a pandemic, and it just makes it that much more difficult. And so I think what we've seen is the power of education, the power of in-person connectivity when possible, as well as just an overall sense of all that we can do to come together as a region during a difficult time and try to support our students. So that's what I've been doing with my last 6 months. So if I had to write a paper on what'd you do over the summer, I think that my response would be similar to a lot of folks. We did a lot of work around trying to get ready for this school year.
Well, this will be the equivalent of your paper, so you won't have to write it. We're going to.
Very good point.
And you were extensively quoted in an article recently published in the Pittsburgh Quarterly. I found the title of that article itself to be thought-provoking. Back to school, 42 districts, 42 plans. So you've got 42 districts in the intermediate unit. They have produced 42 different plans. Is that a good thing or a bad thing?
Well, first you have to step back and take a look at how schools and school districts are organized in Pennsylvania. So in PA here, there are 500 school districts that operate under the guardrails that are established by the Commonwealth. However, each school district is locally controlled by the elected school board. So, this sense of local control really gives autonomy to each school district. And this is helpful in a variety of ways when you're developing your academic and athletics, arts, activities programming. And similarly, each school district is taking then the guidelines and mandates from the Pennsylvania Department of Ed, the Department of Health, the CDC, and trying to develop their health, safety, and academic plans for the coming year. So, this idea of local control is helpful when you're trying to make granular decisions that are based on your own community, but it can be challenging when you're trying to look at decisions that are affecting the educational community at large. So really, to answer your question, it's both good and bad, depending upon the lens that you're looking through.
So let me push you just a little bit further. And I'll do that by referring to two different school districts that you have served. In Peters Township, they're opening up all the schools and they're ready for students to be back physically 5 days a week. The Pittsburgh Public Schools have declared that the first 9 weeks, which now have been delayed, will be totally virtual. So which of those districts is wrong?
So I don't necessarily see either one of the plans as bad or wrong, because I think there's a variety of factors in play as school districts are making their decisions to return to school. From a health and safety standpoint, let's start there. Are you able to open school in a way that is consistent with the guidelines that have been shared? And if you believe that you can, then you work with your families, staff members, and school board and move in that direction. So can you provide 6 feet of physical distancing? Can you ensure that you're limiting the exposure from students to one another and to staff members? And so all of us who work in brick and mortar schools, we know the benefits of in-person instruction. And that's certainly a learning model that most of us subscribe to. But if there are challenges in doing any of that, or if there's community spread inside your school district borders, then a remote learning instructional model may be more beneficial. So I think that your plan has to respond to what you're able to do, but also able to respond to the communities that you serve.
Let's go back just for a moment to your convening role. How often have you been bringing the school districts together so that they can share ideas about how best to approach this challenging problem?
So typically the AIU supports monthly meetings for district superintendents, as well as a variety of other roles in school districts. And those are really great opportunities for all of us to come together and kind of look at those things that we're all sort of responding to in the educational community. But when the COVID-19 hit in March, the AIU began to bring together superintendents, CTC directors, and other community partners 2 days per week. And so this gave the AIU an opportunity to share pertinent information and guidance with the group. And then the superintendents had an opportunity to share best practices with one another. And so that was really an important time, because we really all needed to collaborate and work with one another. We were all dealing with similar challenges. And so that's something that since March has really been in place. And, over the last several weeks, we've scaled that back to just 1 day per week. But I know the folks that are part of those weekly meetings have really found them beneficial as we plan for the coming school year.
And when you bring those 42 superintendents together, I know that it is a very impressive group. They're experienced educators, and they know a lot about managing school districts, finances, and things like that. But there probably aren't many who would claim to be medical or public health experts. So how do you get the information that you need to factor that in a constructive way?
Sure. And that's one of the questions we were all asking ourselves, So as the meetings progressed, we began to include a variety of community partners that were able to support our collective work. And this included the Allegheny County Health Department. Many of our meetings included Dr. Bogan, the director of the health department, and or Dr. Brink, their chief epidemiologist. And their insight has been very helpful because it has been a consistent voice along with that of the Pennsylvania Department of Health. Because, the challenge in all of this in some cases has been that, different medical professionals across the board have offered different opinions. And so that makes it difficult when you're trying to make decisions that are based in the medical field, and we're from the educational field. And so we felt collectively that the more we worked with that consistent voice, and then again, we were all hearing the same message, the easier it was for all of us to think through some of our plans as we consider the coming school year.
You said to me in an earlier conversation that one surprise to you was that we had in Allegheny County this very well-established public health department, and that most counties do not. Is that right?
That's correct. And that was, to your point, something I did not realize until just a few months ago. And so it is a luxury that we have here. We have a Department of Health that we have been able to work with closely. And there's only a handful of other counties in the Commonwealth that have that opportunity. And so while many school districts across Pennsylvania really have had to rely on the PA Department of Health, and that's challenging because then you have a lot of folks trying to access the same resources at the state level, but we were able to rely upon the Allegheny County Health Department. And then that relationship built and over time. And so that they've really been a good resource for us. And I feel very fortunate, not only as an educator in the region, but as someone who lives in Allegheny County that, we have that resource available to us.
Well, it's one of those right place, right time stories, isn't it? Because just as you were plucked from one position to another, Dr. Bogan basically moved in early because of the onset of the pandemic. And not only is she a physician, but a pediatrician who came from Children's Hospital and Pitt. And that has to have been a big plus moving forward to deal with this particular challenge.
Absolutely. So she has that pediatrician sort of lens that she sees things through, and now, of course, is the director. And then you have Dr. Brink, who's the epidemiologist. And so combined, they were really able to provide us some important guidance as we move through this process.
It really is a service that I think we should be proud of here in Allegheny County, that we have had this long-term commitment to public health. And you see it in action in ways that affects every family in the county right now.
I agree.
It's been said right from the start that children are less susceptible to this disease, which I believe is true and is supported by the data. But that sometimes gets converted into a different kind of statement, and that is that children are immune or virtually immune to COVID-19. Based on what you have learned, is that true?
Yeah, what has been conveyed to us is that the case numbers suggest that school-age children are less likely to contract COVID-19. However, they're not immune from the virus. And so that certainly is something that we all need to consider as we're developing our health and safety plans for return to school this year.
And just recently, the American Academy of Pediatrics reported that 476,000 children have been diagnosed with COVID-19. That's nearly 500,000 kids. And that the cases, hospitalizations, and deaths have been rising. Now, they're rising from a very low number. And it still doesn't compare with the impact of the disease on people of my generation or even your generation. But you can see why parents would be concerned. It's a good reason for you to be concerned. You can understand why some families would say, well, we want remote education. On the other hand, I'm sure you have families who say, we want our kids in the building 5 days a week. So one of the challenges, I assume, is that meeting these demands is both difficult and expensive. Is that right?
Correct. And that is really one of the biggest challenges that school districts are facing. I'm not aware of a single community where everyone is unanimous in their position. And so this is why school districts have considered multiple instructional models when possible and when practical to meet the needs of their students and families, because we realize the concerns that folks have from a health and safety standpoint. We also understand that we believe that we can meet the needs of our students in an in-person environment incredibly well because we're organized to do that. And so, so that continues to be sort of a pain point for communities because you've got parents who think very differently about this. But as a school district, our students and of course our families, they're our customers. And so, we have to provide what we can provide for them, because if that's what they want and that's the space that they're in, what can we do to support that?
And it is not just the health of the students that you have to consider, isn't it? I mean, you've got teachers, you've got staff. I think the New York City schools have delayed their opening because their teachers union threatened to strike over safety issues. How are those health issues resolved? Again, on a district by district basis?
They are resolved on a district by district basis, but it really goes back to the process that school districts follow to develop their health and safety plans. And so, again, speaking from experience as a superintendent previously, we were kind of weighing the things that we needed to do from a student standpoint in their health and safety, but equally as much around staff members, because back to the point you made previously, while cases of COVID-19 are not prevalent among school-age children, many of the adults who work with students each day fall within that demographic that is more susceptible. And so you have to be mindful of that. You have to be mindful of, if we can't have enough folks in the school building at a given time, then that makes it challenging. And it starts to then sort of shift your thinking in terms of your instructional model, because it's one thing to think that through even before the school year begins, but another challenge as the school year progresses is, we know what has to occur if someone has COVID-19 in terms of isolation. We also know that close contacts then need to be quarantined for a period of time. So you could potentially have a variety of staff members that don't have COVID-19, but because they've been exposed to someone who has, need to quarantine for 14 days. And if enough of those folks are out of the school building, it becomes very challenging to provide in-person instruction or in-person experiences for those students. So the health and safety of our staff members really is just as important as the health and safety of our students.
And to go back to the programs that you're developing, I guess if you had to develop programs that would meet the needs of in-school education consistent with all of the guidelines, that would be a big expense. If you were converting everyone to remote learning, that would be a big expense, and you've got them both at once.
Right. And I think, there have been certainly additional costs associated with everyone's response to COVID-19, particularly as you plan for this current school year, because you're correct. If you're looking at an in-person model, there are things that you need to do that you may not be in place today. You may need to use spaces differently. You may need to provide more furniture. You may need to add additional cleaning protocols, all of which come with additional costs. But I don't think there's a school district that also hasn't thought through, even if today they're all in person, everyone has to have a remote learning plan because there is always the chance that that will occur. And so all of us had an opportunity to learn from the spring, what worked well, what didn't work well in a remote learning environment. And then every district has responded to that. And in many cases, those response efforts have involved additional technology. They've involved different instructional materials that can be utilized in the case that moves forward. So the challenge is, you're spending monies on things both for an in-person environment and for a remote environment. So in some cases, you're almost doubling the costs. And so those are the things that are really those are the things that school districts need to be mindful of as they make these decisions. Unfortunately, we do have some CARES Act money and some other financial resources that have come in to help offset some of those costs, but those monies were spent very, very quickly. And then you add to that any school district who's trying to create some hybrid environment where you have some students who are in person and some students who are simultaneously remote, that then adds a whole nother layer to this and potentially additional costs. So the costs associated with schooling this year, regardless of the instructional model that you're implementing, those costs are vast.
Well, and we've talked about the differences from family to family and from student to student. But when you look at your 42 AIU school districts, there are pretty significant variations from district to district in terms of resources too, aren't there?
That's correct. And that really it has been a challenge even prior to COVID. The funding and equity concerns across the nation, but certainly here in Pennsylvania, do make things difficult. The funding formula really does benefit those school districts with higher property values, with sources of income that are greater than those districts that aren't in that situation. And so those equity challenges have always been in place. Now you add a layer of, well, how do we support remote learning, for instance? You have school districts that prior to COVID had very robust technology programs, and they were utilizing equipment, they were utilizing technological resources. You had families that had access to Wi-Fi at home. Those are the school districts that were able to pivot rather quickly and continue that learning trajectory, where for other school districts, it was almost as if they were starting from scratch. And so that has certainly exacerbated some of the inequities that existed prior to COVID-19.
So we've already got inequities, and then the pandemic comes, and they tend to be kind of even starker. But you have gotten some help on that front, haven't you?
Yeah, we have. We're very fortunate. So again, this is a space where the AIU, this is kind of our bread and butter and where we exist. How can we provide supports for the 42 districts that we serve? So our mission is maximizing educational opportunities for all students by meeting the needs of the community. Mission is right there. So what we tried to do throughout this process is figure out, what does each district need? Then what can we provide as a resource, as a resource, the IAIU, but what are those other financial resources that we might be able to sort of work with the foundation community, work with other entities, and provide some of those financial resources to the districts that need it most. So in our case, we were very fortunate. We were able to work with 6 Pittsburgh area foundations and received in total grants of $1.5 million. And what that's allowed us to do is that's allowed us to then work with those under-resourced districts to provide devices, to provide access to technology and resources that previously they weren't in a position to do that. It's also given us an opportunity to provide professional learning, not just for those districts that I just mentioned, but for all districts countywide, because the pedagogy of education in a remote environment looks different than an in-person environment. And so how can we ramp up those professional learning opportunities so that when we're in that position again, we can make sure that, again, that learning trajectory continues so that we're not all of a sudden shifting into a very different environment where the learning experiences are vastly different.
We see so often in this region that one of our truly distinguishing assets is the foundation community that we have here, and to see the things that they have done, whether it is supporting education, dealing with issues of hunger, or in a broad range of ways. A lot of credit will go to them when we come out the other end, hopefully in pretty good shape. Now, we've been talking about the Allegheny Intermediate Unit kind of helping the other districts. But you've got your own programs too, don't you? I mean, I saw you had to develop 3 separate health and safety plans, one for your kind of central office and one for early childhood and one for special education. How does the challenge of the pandemic impact, for example, your delivery of special education programs where kids really need them and they can't get them from their home districts?
Correct, and so it goes back to sort of the breadth of programs that we offer here at the AIU. And so you mentioned the 3 health and safety plans that we had to develop, and one of them was for our 3 special education schools. And so, every school district has resources within their district to support students with unique learning needs, particularly those with an individualized education plan or IEP. But in many cases, those needs are so complex that the home school district just can't do that. They're not organized to do that and do that well. So we offer 3 special education schools across the county for those students. And so because they are some of our most vulnerable students, and because many of their educational needs really aren't met well in a remote learning environment, we started those schools actually yesterday. It was the first day of school at Mon Valley, Pathfinder, and Sunrise, and we're all in person. And so all of our staff members there, our support aides are there. The students were incredibly excited to start school yesterday, but that is one of the resources that we provide because we know that some of those unique, complex learning needs just can't be met in other ways. And so we have to have a health and safety plan that allows us to deliver that instruction to those students, ensure those learning opportunities, but continue to do it in a safe way, safe for the students, but also safe for our staff members. And then the other one that you mentioned, so we do have a health and safety plan for essentially our central office, but the 3rd health and safety plan we have is for all of our programs that fall under our early childhood. It really is a pretty robust program. In fact, half our staff members are really allocated in this world that supports kids from birth till the time they go to school. And so that's like DART and Head Start and Early Head Start. We provide 10 family centers throughout the county. And so there's a lot of things that we do to really support kids outside of what we would consider the traditional K-12 experience. And so each of those programs is unique because some of those we provide support directly in the home, and other places we have specific sites. And so we've had to really think creatively because, if memory serves me correctly, I think we have 600 unique sites that we service. Some of our own, some are in school districts. And so we've really got to be cognizant of what are those health and safety needs in each of those spaces.
And while we talked about the variations in programs from district to district, reflecting the different needs of the district, the different attitudes of the school boards that ultimately need to approve the plans, my sense is that all of them do involve compliance with the public health guidelines that have been stated and restated time and time again. Is that right?
That's correct. And I'm laughing, or not, I'm smiling as you're asking that question because, as the school districts, develop those health and safety plans, you have to be mindful of, there's mandates, there's actual orders that have to be followed, but then there's also guidance and guidelines that have been developed. And so each school district put together, a team of stakeholders that looks slightly different in every school district. You had to identify who your pandemic coordinator was, and put together a health and safety plan that was mindful of the students, that was mindful of the staff members, et cetera. But then that plan has to be shared, in some cases pitched to the school community because of folks' different thoughts on all of this. And then at the end of the day, it ultimately has to be approved by the school board. And so then once the school board approves it, then it has to go to the Pennsylvania Department of Education. And so many of our school districts from the time, well, probably early June until just these last several weeks, I mean, that has been so much of what their time has been spent on. How do we keep everyone healthy and safe? And then how do we consider the educational models, the instructional models that we want to implement that balance the health and safety needs, as well as the concerns that you might have about shifting back into a remote or even a hybrid learning environment?
And is wearing masks a suggested habit, or is that something that is required in all the plans?
Yeah, masks are required. And it was interesting because there was some preliminary guidance shared a while back that was then clarified roughly a week and a half or 2 weeks ago. So early August, mid-August, let's say that. And in mid-August, it clarified that if you are inside a school building, you must wear a face covering. I use the word face covering, and I'll get back to that in a moment. So you must wear a face covering when inside, unless you are eating. And then if you're eating, you have to be at least 6 feet apart. In addition, you're allowed to take mask breaks. And so you're allowed to take 10-minute breaks throughout the day. So yes, there is a mask order for anybody who is inside a school building. If you are outside the school building, you can take the mask off, but then you have to, again, be 6 feet apart from any other students or staff members. And so when you really start to think that through, that really does change a lot of the experiences that we're used to seeing in a school. So the mask order is a challenging one, because before that clarification in mid-August, it was interpreted slightly differently in some school districts. In some school districts, as long as you had kids 6 feet apart in a classroom, you were permitted to they were permitting in their health and safety plan for you to take off that mask. And in other cases, no, it was you wear that mask all day long.
You know, you indicated earlier that the districts in Allegheny County had benefited from some of the services that are available through the county, such as the health department. You also have indicated in our conversations that your success, the success of these 42 districts, really also is dependent upon the people of Allegheny County. What do you mean by that?
Well, I think that, we all want students back in school in person. We know that that's best for students. We know that that's how we're organized to educate and support students and families well. But we can't do that until we get to a point across the board where community spread cases are lower, where we have less positivity. And so there are some metrics that we all are looking at, and we all want to get to that point. And once we can, then we can those school districts that started in a remote environment can start to shift back to in-person. And so it's not just those folks who have kids in school, not just those folks who are directly affected by an educational entity. It's the entire county, and even surrounding counties, that will help dictate and determine when we're able to safely get back into schools. And so that it really is a community effort, and that's something we want to continue to remind folks.
When you think about it, whether you do have children of your own enrolled in schools or not, these children are our future. We all do have a stake. We do talk often, and I think with rightful pride about the sense of community that does exist here in our region. And this really would be a good time to show it because, as you have said, community spread, the extent of community spread, which you can't control, really is going to be a big factor in what the next year is like for the 114,000 students that you're serving. Well, I can say this, Allegheny County gained from North Allegheny's loss. It's great that you're in this position. You clearly have brought a very thoughtful approach to your new responsibilities. And maybe at some point during the year ahead, we can have you back and talk about how things are going. And hopefully it will be a good news story.
I hope so. I mean, I think that, we're doing everything we can in the region right now to respond to where we are. For those that are moving into remote learning environments, we have resources here to support them, waterfront learning and other things that we can do to make that experience as absolutely positive as it can be. But we also know that we want to get all kids back at some point. And when we do, hopefully we have a success story to share, and we would love to be back and tell that story.
Well, thank you very much for spending this time with us today, and good luck with all of your important work.
Thank you very much. Appreciate having the opportunity to meet with you today.